As our population ages, healthcare professionals face the growing challenge of meeting the unique needs of older adults. One area of critical importance is medication management. Older adults often take multiple medications for various health conditions, increasing the complexity of their care. Understanding the impact of aging on drug behavior is essential to ensure medication safety and efficacy in this vulnerable population. Before we delve into the specifics of pharmacokinetics and pharmacodynamics in older adults, let's review the fundamentals of these concepts. Pharmacokinetics refers to how the body processes drugs, encompassing the processes of absorption, distribution, metabolism, and excretion, also known as ADME. Absorption is the process by which a drug enters the bloodstream from its site of administration. Distribution involves the drug's movement from the bloodstream to various tissues and organs. Metabolism, primarily occurring in the liver, transforms drugs into metabolites that are more easily eliminated from the body. As we age, our bodies undergo various physiological changes, and the gastrointestinal or GI tract is no exception. These age-related alterations in the GI system can significantly impact how drugs are absorbed into the bloodstream, potentially affecting their efficacy and safety. One notable change is the decrease in gastric acid secretion. Gastric acid plays a crucial role in dissolving certain medications, making them easier to absorb. With reduced acid production, drugs that require an acidic environment for optimal absorption, such as calcium carbonate and iron supplements, may not be as readily available to the body. The age-related changes in the GI tract, as discussed earlier, can have significant implications for drug absorption in older adults. Reduced gastric acid secretion, for instance, can impair the absorption of certain medications that rely on an acidic environment for optimal dissolution and uptake. For example, medications like calcium carbonate, used to treat heartburn and calcium deficiency, and iron supplements prescribed for iron deficiency anemia may not be as effective in older adults due to reduced gastric acid. This reduced absorption can lead to inadequate treatment of the underlying condition. Section 3, Clinical Implications for Medication Administration. Understanding the impact of age-related changes in the gastrointestinal tract on drug absorption is crucial for healthcare professionals when prescribing and administering medications to older adults. Dosage adjustments, alternative formulations, and careful monitoring are often necessary to ensure medication efficacy and minimize the risk of adverse events. For medications with reduced absorption due to lower gastric acidity, healthcare providers might consider adjusting the dosage, prescribing an alternative formulation that doesn't require an acidic environment for absorption, or advising patients to take the medication with acidic beverages like orange juice. Section 1, Body composition changes with age. Aging alters the distribution of medications within the body. Drug distribution is how a drug travels from the bloodstream to tissues and organs. Aging changes body composition, affecting drug distribution. Notably, total body water decreases. Less water means higher concentration of water-soluble drugs. This can increase the risk of side effects and toxicity. Section 2, impact of altered distribution on drug levels. The age-related changes in body composition, as we've just discussed, have a profound impact on drug distribution and consequently drug levels in older adults. Understanding these changes is paramount for healthcare professionals to ensure medication safety and efficacy in this population. For instance, the decrease in total body water can lead to higher concentrations of water-soluble drugs, such as lithium, a mood stabilizer, and gentamicin, an antibiotic. These higher concentrations can increase the risk of dose-related side effects. Careful monitoring of drug levels through blood tests and appropriate dose adjustments are often necessary to prevent toxicity. Given the significant impact of age-related changes in body composition on drug distribution, healthcare professionals must consider these factors when prescribing and monitoring medications for older adults. Individualized dosing strategies, careful medication selection, and close monitoring are essential to ensure optimal therapeutic outcomes while minimizing the risk of adverse events. For water-soluble drugs, starting with lower doses and titrating based on clinical response and monitoring of drug levels is often recommended. This approach helps to prevent excessively high drug concentrations in the bloodstream, reducing the risk of toxicity. As we delve into pharmacokinetics in older adults, our focus shifts to the liver, a crucial organ for drug metabolism. The liver breaks down medications into metabolites, transforming them for elimination. With age, the liver's ability to metabolize drugs declines due to reduced liver mass. This leads to slower drug clearance and increased drug levels in the bloodstream. The age-related decline in liver function, as discussed earlier, has significant implications for drug clearance and half-life in older adults. Drug clearance refers to the rate at which a drug is removed from the bloodstream, while half-life refers to the time it takes for the drug concentration in the bloodstream to decrease by half. Both of these parameters are crucial for determining appropriate drug dosages and dosing intervals. With reduced liver function, the clearance of many drugs, particularly those that rely heavily on hepatic metabolism, slows down. This slower clearance means that drugs remain in the bloodstream for longer periods, increasing the risk of drug accumulation and potential toxicity. For medications with a narrow therapeutic index, even small increases in drug levels can have significant clinical consequences. Section 3, Clinical Considerations for Medication Management. Given the profound impact of age-related changes in liver function on drug metabolism, healthcare professionals must carefully consider these factors when prescribing and managing medications for older adults. Adjustments in dosages, dosing intervals, and medication choices are often necessary to ensure both safety and efficacy. For medications that undergo significant hepatic metabolism, starting with lower doses and titrating gradually based on clinical response and monitoring for side effects is crucial. This approach helps to minimize the risk of drug accumulation and toxicity, especially in older adults with compromised liver function. Section 1, the aging kidneys and drug excretion. The kidneys serve as the body's primary filtration system, removing waste products, including drug metabolites. However, age-related changes can impact their ability to excrete drugs effectively. A decline in renal function is a well-documented change associated with aging. This decline begins in early adulthood and progresses over time, and the rate of decline varies, but it's a nearly universal phenomenon. The kidney's ability to filter waste, measured by glomerular filtration rate, GFR, diminishes with age. Section 2, impaired clearance and drug accumulation. Age-related decline in renal function impacts drug clearance and accumulation in older adults. Drug clearance is influenced by the kidney's ability to filter and excrete drug metabolites. Declining renal function slows drug clearance, leading to higher drug concentrations. This is problematic for drugs with a narrow therapeutic index like digoxin and lithium. Small increases in these drugs can lead to significant toxicity. Section 3, clinical implications, monitoring and dose adjustments. Recognizing the significant impact of age-related changes in renal function on drug excretion is paramount for healthcare professionals when prescribing and managing medications in older adults. Careful monitoring of renal function, appropriate dose adjustments, and consideration of alternative medications or treatment strategies are essential to ensure both medication safety and efficacy in this population. Estimating renal function is a crucial first step in assessing an older adult's ability to handle medications. Creatinine clearance, calculated using the patient's serum creatinine level, age and weight, provides a reasonable estimate of GFR and helps guide dosing decisions. However, it's important to note that creatinine clearance may overestimate true GFR in older adults with reduced muscle mass, a common consequence of aging. Altered drug responses in older adults. We explore pharmacokinetics and pharmacodynamics in older adults. Pharmacokinetics focuses on drug processing, while pharmacodynamics examines drug effects. It studies drug interactions with molecular targets. Aging alters receptor sensitivity and homeostasis, affecting drug efficacy and increasing side effects. Understanding pharmacodynamics in older adults requires examining age-related changes in receptor sensitivity. Receptors on cell surfaces act as gateways for drug interactions. Aging alters receptor number, affinity, and function, affecting drug response. For example, beta-adrenergic receptors decline with age, impacting heart medication efficacy. Higher doses may be needed, but this increases side effect risks. Age-related changes in pharmacodynamics have profound clinical implications for older adults. Recognizing that older adults respond differently to medications is paramount. Individualized treatment strategies are essential for optimizing outcomes. Start low and go slow is key principle. This cautious approach mitigates the risk of exaggerated drug effects. Medication management in older adults is far from a one-size-fits-all approach. The aging process necessitates a nuanced perspective, recognizing that what holds true for younger populations may not apply to older individuals. Age-related changes in absorption, distribution, metabolism, and excretion can impact how medications are processed, leading to variations in drug levels and increased risk of side effects. The liver's efficiency declines with age, slowing down medication breakdown and potentially leading to drug accumulation. The kidneys also decline in function, impacting the body's ability to eliminate drugs effectively. These changes underscore the importance of careful medication selection, dose adjustments, and regular monitoring for signs of drug toxicity. Promoting safe and effective medication use in older adults requires a collaborative approach. It empowers patients to participate in their care. Pharmacists play a crucial role in optimizing medication therapy. They provide insights into dosage adjustments and alternative options. Nurses monitor patients' responses and communicate concerns. They reinforce medication adherence and educate on side effects.